Hello, I'm Dr. Jamie Oskin, and in this video what we're going to talk about is homeopathic treatment of autism spectrum disorders. And I'm going to go through and share a little bit of research on homeopathy and autism, tell you what that research found, give you some expectations for what's possible with homeopathic treatment, and I'm going to actually go through 6 cases of my own to share with you the results. And all of the cases are different. All of the cases do have a component of speech delay that improved with homeopathic treatment. And but each case is unique and different. So I'm hoping that through these cases you may see elements that are similar to perhaps your child or your grandchild that could possibly be helped with homeopathic treatment. If you're interested in more information about that, or interested in reaching us, our website is here, aznaturalhealth.com, or we have a private Facebook group called Homeopathy for Autism, spelled with the number 4, as you can see in this slide, where we have lots of educational videos and interactive kind of videos and chat with folks to answer questions about homeopathy. So one of the first things I want to share with you is how did I get interested in this? When I was in med school, of course, I decided to go to med school actually initially to solve some of my own health problems, and I ended up going to naturopathic medical school because I decided that for my particular health concerns, it was changing my lifestyle that actually helped heal myself. And conventional medicine didn't really have an answer for that. And when I was in naturopathic medical school, I also got exposed to homeopathy, and I had some problems, and homeopathic medicine actually quickly helped resolve those problems. And I thought, wow, this is actually pretty interesting. And initially, I'll be honest, I was kind of skeptical of homeopathy, but then when it worked on me, I became curious. And so then I started watching it in the clinical rotations and seeing it work really well with patients, and got more and more interested. So when I was young in practice, and I've been in practice over 14 years now since I graduated from medical school. But when I was early in practice, I actually did a specialty residency in homeopathic medicine after my general practice residency. And then I went out into private practice, and I knew there were certain folks that I really like working with, and especially children. But there was an early case that really spoke to my heart that got me really along the path of working with children. And there was this little boy who's 22 months old and had 15 rounds of antibiotics for ear infections in 22 months. And he had ear tubes placed. And even with the ear tubes, he was still getting antibiotics every 3 to 4 weeks for a new ear infection. And along with this, he was speech delayed. And so we treated him with homeopathic medicine, and the most amazing thing happened. Like he went on to become healthier. He stopped getting ear infections. In fact, he only had one other ear infection that I know about, which was 6 months later when the family was at Disney, and because they were out of town and on vacation, they took him to urgent care, and he was prescribed antibiotics. But after that, he never had another ear infection. And then within that first 6 months, he went from being language delayed to language advanced, and just started to thrive in daycare and preschool. And now that boy is incredibly a teenager. It's amazing how time flies. But and here's this healthy, boy, and it was so inspiring to me that both to change that child's world, to become healthier, and also to help the family, that I knew that was really an area I wanted to help with children, particularly with developmental delays. And as things happen, that was early on in my practice, and more referrals came to me to help other kids, because you know how it is as parents. You say, one parent gets help, and they tell another parent, and they say, hey, you really should see Dr. Oskin because he helped my child. And it's just been the most rewarding experience getting to help kids. And so what I want to share with you in this video is my experience. I just want to share from the heart my experience and let you know what I've seen over the years. So with that said, let's get started. And the one of the reasons I want to talk about autism in particular, and I work with a lot of children with autism, is that there's something seriously wrong going on. There's this exponential rise in autism, and you could see by the map that it's just gone up and up and up. And I actually think this is now out of date from 2018. I believe it's now 1 in 42 children have autism, which is incredible. If you think about that, that's more than 1 in every 2 kindergarten classes. And even when I was a kid, it was 1 in 10,000. So we just didn't have that many kids in special ed. And now we have a really serious problem on our hands. And there are many potential reasons why that may be. I don't know that I have all the answers for that, certain environmental changes, etc. But, last week I just had a new patient in here, 2 new patients actually, because they were brothers, both language delayed, and they need to get diagnosed, but I'm almost certain they both are on the autism spectrum. And the family is from Africa, and they were referred to me by another patient of mine who's improved with homeopathic treatment, and that family is also from Africa. And I heard independently from both of these families, they said something's wrong here in America, because they said I can name 10 families in our community that have this problem, and back home, like, we didn't know anybody with this problem, and here there's so many kids that are cognitively and speech delayed. And he said it was so bad, in fact, that one of his friends at church is going to move back to Africa before they have more kids, because they're worried that there's something environmentally wrong in the United States. So it's a real problem, and the reason we need to talk about it is, here's that number. 1 in 44 is actually the current number, and the citation to the CDC is there. And I'm sure that will be out of date, soon, but that's where it currently stands. But a lot of parents are wanting alternatives, and why is that? It's because, truth be told, conventional medicine doesn't have a lot to offer. There are lots of therapies, which are great. The therapies, really help the children, whether it's speech or occupational therapy or ABA, but there's not a lot of treatment options. And parents want alternative, and the reality is homeopathy can really help. So firstly, let's just go over some of the main features of autism. Autism has 2 main features, actually, and this is from the diagnostic manual, the DSM-4, the DSM-5. The first main feature are persistent deficits in social communication and social interaction across multiple contexts. So you may have, it may be verbal speech that's the problem, or lack of eye contact, or just not an abnormal social interaction with other humans. Autism literally means to himself. So that gives you an idea a little bit about what the disorder is about. The other thing is that the other main feature in autism are restricted, repetitive patterns of behavior, interests, or activities. Oftentimes we say it's like OCD, and these get very, very intense. Like, kids only walk on their tiptoes, or they spin in circles, or they flap their hands, or they will only eat a certain brand of chicken nuggets that comes in a certain box and has a certain label on it and is cooked a certain way. Or they only play with toys in a certain way, or they line up all their trucks not to play with them, but they all have to be exactly perfectly in a line, or something like that. So we see these restricted, repetitive patterns of behavior. And these kids need really strict routine, and when their routine gets broken, oftentimes we see lots of tantrums. Now, it is a spectrum, which is wide, which means that some kids are very severely affected. They may be nonverbal, severely cognitively delayed, while other kids may be socially quirky and awkward, like Sheldon on The Big Bang Theory, but they can speak and they can read and they can go to interact at school and be mainstream in school classes and what have you. So there's a really, really wide spectrum of severity. And the diagnosis has some subcategories of severity based on those qualifiers. So what are some other treatments? The main focus of this presentation is going to be on homeopathy, but there are other treatments. So one would be ABA. This is the main conventional therapy, applied behavioral analysis. Speech therapy is a biggie. Occupational therapy is often very helpful for kids. There are some alternative ones. Now, this one's an interesting one. It's not one I do, but it's called in-listen therapy. And I first read about it in a book called The Brain That Changes Itself by Norman Doidge. It was either that book or his second book. He has two books that are really fascinating. And they're about neuroplasticity and the brain's ability to heal and change. And it's a therapy where they do intensive therapy with a listening device, and it helps rewire the brain in terms of the auditory pathways. Functional medicine. So functional medicine is like typically a lot of your natural medicine doctors. They may be medical doctors or naturopathic doctors, but they're using a lot of laboratory tests and supplements and maybe dietary changes in their treatment plan. There's one that's become popular recently called the Nemechek protocol with omega-3 fatty acids, olive oil, and inulin. We know that omega-3 fatty acids are really important for brain health. And I would just say as an aside, I do a lot of nutrition work with patients, and we also do lab work on our patients. And I routinely see that patients are on the autism spectrum are omega-3 deficient, and we correct that when we get them on high quality omega-3 supplements, and including healthy fish in the diet if we can get the child, especially when they're picky eaters, to eat it. And we also, I have a big push to eliminate omega-6 oils from the diet. These are your vegetable and seed oils, like coconut, canola, cottonseed, soy, sunflower, and safflower. Those are the biggies. They are really, really toxic and inflammatory, and they're not good for the brain. So even though this talk is about homeopathy, that's some advice for you. I would recommend reading labels. The sunflower oil and safflower oil seem to be in all these packaged products, chips and crackers and cookies and what have you. And a lot of restaurants now are frying in those oils because they're cheap, or frying in soybean oil because it's cheap, but they're really, really bad for brain health. So we want to push the omega-3s and reduce the omega-6s. There's another test. I'm going to talk about this in a case, the folic acid receptor antibody test, which is fairly new in the last probably 5 years. Some research that is showing that some kids have an autoimmune reaction where their body's immune system is attacking themselves at the folate receptor in the brain. Folate is a B vitamin, and so basically this B vitamin can't get in the brain, and so these kids might have enough in the blood, but their brain is deficient. And when we identify this problem and treat it, the main thing that they found in the research that it helps is speech delay, and I've been using this with patients probably for 4 or 5 years. Nutrition, there's lots of other nutrition approaches for kiddos on the spectrum. Some popular ones are the gluten-free, casein-free diets. Many parents try those. The GAPS diet is another popular one. So in my personal practice, we treat folks holistically. We have health coaches trained to work with parents to help their children, and nutrition often plays a role in the healing. Another tip I'm going to give you is to limit screen time. Screen time seems to be really, really detrimental to a developing brain, especially under the age of 2 and probably under the age of 5. But there was a new study out recently from Japan showing that literally the more hours per day a child has exposure to screen time, the exponential increase and rise in autism diagnosis. So when you go from 1 hour a day to 2 hours a day to 3 hours a day, the rates of autism just go up significantly. And in this study, they were looking at screen time before the age of 1, and then the later diagnosis of autism. So it makes sense when people are interacting with, when babies are interacting with screens, this is a time of critical brain development, and the brain is wiring. And when you communicate with other humans, there's a back and forth, there's an interactive component of that. And when you're just passively looking at a screen and taking in information, it's a one-way directed communication pathway. The other thing is that the screens and the videos are highly dopamine stimulating, so they're very addictive. Both the sound, the colors, the lights, the changes of the screen photo positioning, they're really, really highly addicting. And so kids become very, very addicted to this as a form of communication. And so we're seeing other things related to screen time, like exponential rises in attention deficit disorder, etc. So I can't urge you enough. The American Academy of Pediatrics recommends 0 screen time for children under the age of 2. And, I can't emphasize enough that is really important. Now, I totally get, occasionally you need to have the TV babysit your child so you can get a shower or something, but really we want to limit it as much as possible. So let's now shift gears and start to talk about homeopathy and how homeopathy can help kiddos with autism spectrum disorders. And homeopathy is a very specific therapy, and I'm going to go into a lot of details to share with you so you get to understand the therapy. But we can help with language delays, sensory processing problems. This is a biggie because conventional therapy and conventional treatments don't really have good treatments for sensory processing disorders. And homeopathy can really help the sensory symptoms, and I've seen that repeatedly, that we're able to reduce the sensitivity to light or sound or touch, what have you. Tantrums, so behaviors can improve significantly with homeopathic treatment. Violent behaviors, I just had a case yesterday that I've been working with for about 1.5 years and has been making steady progress, and he's making improvement in speech. He's calm. He used to be violent. He didn't sleep through the night. Now he's sleeping through the night. Now he's using words at school to tell the teachers what he wants. He can even now read. They didn't know he could read, but they used flashcards and realized that he could repeat the words and that he knew how to read, even though they never taught him. This is an 8-year-old boy. So these kind of concerns routinely improve with homeopathic treatment. The other thing is that homeopathy is a holistic therapy. So in conventional medicine, you may see a different doctor for allergies or digestive problems or skin rashes compared to the doctor that treats the autism. But in homeopathy, we look at these as all interrelated. And you're going to see that with some of the cases I share with you from my practice, that when let's say a child has seizures and eczema and those things start to improve, that also their speech delay improves as well, because holistically, as we're stimulating healing in the child as a whole, they get better across multiple different concerns. So lots of kids on the spectrum have allergies or digestive problems, constipation or diarrhea, very, very common on the spectrum, skin rashes. And so what our goal is, obviously we want to really aim the target at the speech or cognitive delays or behavioral concerns, if those are really a main point of distress for the child and for the family. But we also want to look holistically to help them be healthier. So if they're getting frequent infections or frequent ear infections or what have you, that those concerns improve as well. The other good thing is that homeopathic remedies are really easy to take and they taste good. So most kids like them, even really finicky eaters. And this makes homeopathy a much easier therapy than taking gobs of supplements or like IV chelation therapy, where a child has to be held down just to get the IV chelator in them, or what have you. So this is a really good thing, and I found it routinely over the years easy for families to administer the homeopathic medicines. The kids like them, they take them easily. So let's talk a little bit about some homeopathy research for autism. This is probably one of the most interesting studies that I know about, and it was a real world research from India. Homeopathy is quite popular in India. In fact, a lot of my patients who have immigrated to the United States from India come to see us for treatment of their children with autism because they're familiar with homeopathy because it's so popular in India. Anyhow, this research came from India, and you see the citations there. But let's go through it. So this is an observational study. Now, an observational study is different than like a randomized double-blind placebo-controlled study. An observational study is more of what we call real-world research. It's really telling us what are the timelines that we can see improvement in, what are some of the possible interventions. So in homeopathy, we individualize the treatment for every different child and all their unique different symptoms. So it's not a one-size-fits-all approach. So what are the important homeopathic medicines, etc. So this study took place between 1998 and 2009. They had 123 kids, which is a pretty large sample size, and they used some standardized treatment measurement scales. So one is called the Autism Treatment Evaluation Checklist, the ATEC. You can find that online, download it. You could track, monthly to do it and track the scores. CARS is the Childhood Autism Rating Scale, and another is the AHS, the Autism Hyperactivity Scale. In this study, they had a good cross-section of children with various age groups, both genders. They also had a cross-section of children with mild, moderate, and severe autism. So they got to see what would you expect, let's say, with a year of homeopathic treatment in terms of results from these different categories of severity of diagnosis. One of the really interesting things, like I said, we completely individualize every case, every child. I always say if you met one child with autism, you've met one child with autism. They're all unique and special, and they all have unique and individualized symptoms too. And so they may have common features like the speech delay or the trouble with social interaction, but they also have unique symptoms that maybe one child has more sensory symptoms or another child has more other symptoms. And so in this study, they actually identified which were the common homeopathic medicines in these subtypes. So, for example, there are certain homeopathic medicines that are very frequently indicated that can help children on the autism spectrum with sensory symptoms like sensitivity to touch, sound, smell, or vision. Some medicines that are much more commonly indicated in hyperactive or impulsive cases or in cases with violence or destruction. Not every case has this, but there are some kiddos who have more hyperactive, aggressive, destructive, self-injurious behaviors or violent behaviors. And so we've identified which homeopathic medicines are more commonly indicated in helping these children. Regressive subtype, like kids who have involuntary stools, urine, lascivious behaviors, which means sexual behaviors at, let's say, really excessive masturbation at a very young age. I had a case, I'm not going to present this case today, but I have a case that I've been treating probably for about 8 years, that now the child is, I think, 18, and he's done really, really well under our care, and now has some basic speech and can do handwriting. He can text message. He's made remarkable progress, and he was really, really severely delayed. When they came to me, when he was about 10 years old, he used to masturbate for about 3 hours a day. And it's normal to have healthy sexual desires, but for a young child to masturbate that excessively is excessive, and to the point where it was dysfunctional to the family, because the boy would only do it in the shower, so he'd be in the shower for hours of the day, and they couldn't get the child out, and so it caused some stress for the family. And so this is one of those things that we have homeopathic medicines that are more individualized to those symptoms, and I can tell you this child has improved quite remarkably under our care, and that's no longer a major concern for them. Affect or mood. So sometimes we see cases where a child actually, despite the core autism symptoms, has incredible empathy or a desire to be with people, which is actually unique. Maybe they don't have the social skills and they're really, really awkward, but the fact that they are so empathetic, for example, is striking and individualizing, and so that helps us with the homeopathic treatment to pick an individualized medicine. Many kids have intense fears, like fear of the dark, thunderstorms, ghosts, downward motion. Like I had a really great case about a year ago where this little girl on the autism spectrum was terrified to go on the swing or down the slide. She wouldn't do anything with downward motion. And when we started treating her with homeopathic medicine, this improved quite dramatically, and now she plays independently on the playground, can go down the slide and all that kind of thing. But along with improving the fears, she improved globally in terms of starting to make better eye contact and some initial speech, and she had aggressive behaviors that improved as well. Some kids are really afraid of being alone or strangers, crowds, heights, etc. So these types of fears, especially if they're very intense fears and consistent fears, they can be helpful to us as homeopathic doctors to individualize the treatment to help your son or daughter. Some kids are unique in that they have autistic savant capabilities, like they can read the mother's mind, or they have unusual, inexplicable knowledge of languages that was never taught to them. And so that could be a useful guide. And I have the picture here from Rain Man, and Rain Man's kind of the example that pops in a lot of our minds from Hollywood about the autistic savant. But these are unique and individualizing symptoms, and when they are present, they can also be helpful for the homeopathic doctor to individualize the treatment. Now, one of the things that this research study also found is that some cases have a strong causation in the history. So, for example, a very strong emotional trauma. So, for example, there was a case in the research study where a child was developing fine, but then the mother suddenly died, and the child, around 2 years old, didn't know what happened and was very shocked by the experience, didn't know where the mother went, etc., and essentially went into like a state of shock and grief, and then regressed into autism and stopped speaking. And they were able to find a homeopathic medicine that was individualized to that emotional trauma and help her significantly. And I've also seen that in my practice. I'm going to share a case like that today. Some suppression from allopathic medicines. So, you use like heavy steroids or antibiotics early in their life, and then let's say there's a shift in the microbiome or what have you, and the child regresses after the use of those medications. Now, in the research study, 1/4 of the cases had a history of severe fulminant acute infection prior to the onset of autism. And that's really interesting. Now, in India, there are different diseases that are more common than in the United States, like malaria, pneumonia, etc., hepatitis. We don't quite see those things here in the U.S. But what's interesting is clearly there's an immune component for some children, and they have this really overreaction to an acute infection, and then it affects somehow through the immune system and the inflammation, the brain development, and the children regress. Now, in this research study, they had 3 cases that happened after the MMR vaccine. Out of the 123 total cases. So it gives a sense that, at least in this particular research study, vaccines were not a major driver of the development of the onset of autism. But what it does tell you is that, when we individualize cases, different stressors, whether it's an environmental stressor, an acute illness, a vaccination, different stressors can, in a child who's genetically susceptible, can trigger a reaction. And here we had some cases that were triggered by vaccination. And I've seen, in my practice, I've seen many kids on the spectrum who are either unvaccinated or their onset of their autism had no relationship to vaccination. And unfortunately, I've also seen many children who had very clear regression after a vaccine injury. So I think it can be either way. And in conventional medicine, they have no way to individualize the treatment for that. And I'm going to share some cases of vaccine injury later. So if that's something that you've noticed in your children, you may want to to see those cases and see how the children responded and the improvements that they made. Because with homeopathy, one of the good things is we're able to individualize the treatment to help that. So let's talk about the results in this research study. So this is the autism treatment evaluation checklist. This is what it looks like, and the parent can fill it out, and then the researcher can grade it. And they look at different components like communication, sociability, sensory symptoms, and health and behavior. And they did a baseline test 6 months before treatment and then started the homeopathic treatment. And you can see by the graph that there was pretty marked improvement with the homeopathic treatment. And there was about a 34%, and before treatment, actually, there was worsening. You can see that here on the graph. And then after treatment started, the kids started to improve. And there's a 34% improvement in the first quarter of the year, in the first 3 months, which is really optimistic because it shows a strong correlation to the intervention and the timeline of improvement, and 60% improvement by 6 months into treatment. And they also found that kids with strong sensory symptoms had a significant improvement, 43% improvement by 18 months. And this is particularly helpful for homeopathy because homeopathy, like I told you, is highly individualized treatment, and there are certain homeopathic medicines that are helpful for strong sensory symptoms, and different ones depending on different homeopathic medicines depending on which sensory symptoms are prominent, like let's say sound or light or smell, for example. And some kids have multiple sensory symptoms, but because those are symptoms that are really helpful to the homeopathic doctor, and they help us find homeopathic medicines, it's not surprising that in this research study, they found that those kiddos improved quite a bit with homeopathic treatment. On the autism hyperactivity scale, where they're looking at restlessness, spinning, object fixation, and fidgeting, you can see they had significant improvement over the course of the treatment. And with the childhood autism rating scale, within 1 year of treatment, 9 mild cases improved below the score of 30, which is into the neurotypical non-autistic range. And this gives you a sense, out of the study, that's about 7% of all of the cases in the study. And they also had 10 moderate cases that became mild. I think this is really important as a point, like what we expect when we're using a therapy that stimulates a self-healing process in the body. We don't expect that magically overnight there's going to be a flash in a pan and all of a sudden a child that's, let's say, severely autistic is going to wake up totally neurotypical the next day or even the next month, right? What we expect is slow and gradual progress, and we expect that the severity reduces. So, severe cases may become moderate cases may become mild, and mild cases have the opportunity to potentially become in the neurotypical range, and especially maybe mainstreamed in school. And that's been my experience in clinical practice over the last 14 years. I've seen a number of kids who were, let's say, in the severe category after several years of treatment get moved into the moderate. Let's say they actually switched classes into the moderate special ed classroom, or if they were in the mild special ed classroom, start to be able to be mainstreamed into some courses or all of their courses at school. And I think that's really optimistic, but it also gives you a sense of what's possible and what are realistic expectations, because we don't want people to have unrealistic expectations when they start treatment that maybe they're expecting that we shoot for the moon and don't get there overnight, right? So there's always hope, even at any age. I'm going to share with you different cases of different ages, but I also want that to be realistic, and I think the research kind of bears that out. And so the majority of cases, like I was saying, improve on a range from more severe to less severe symptoms. So out of the total study, 89% of the cases improved over the course of the treatment. 8.33% of the cases had no improvement, and 3.33% of the cases worsened. I think this is a really helpful question that I get from a lot of parents. Like, how often can we expect homeopathic treatment to help? I think here we have, some clear data from an outcomes-based real-world study that within a year of homeopathic treatment, this is the percentage of kids that were able to be helped. And also a realistic timeline. So, one thing I do in my practice and is that I have I work with patients with a commitment for longer periods of time to work together, because I now know after so many years of treatment that sometimes it's trial and error. Sometimes we don't get the right thing right off the bat. And because of the nature of the type of condition, we expect slow and steady progress over time. And so, if we just try for a month and don't get results, it's kind of a waste of everyone's time and money. And, I'm really not interested in that. If I'm not the right doctor for you, that's okay. But I want to work with people who are really interested in helping their kids get better and committed to the process, even if it's a long-term process that we're committed to, because we want to see those changes in the kids over time. And I think if we have realistic expectations, that it's going to be steady and gradual over the long period of time, I think we're all on the same page, and so we know what to expect. I think we run into problems when people expect a certain outcome or some sort of magical outcome that's instantaneous, and it doesn't happen that quick. So anyhow, that's just my commentary on that. And the lessons learned are kind of in line with that from this research study, at least, that we expect slow and steady progress. And the earlier the intervention, the better. So I've seen this repeatedly in practice. Like if I have the opportunity to help a 2 or 3 year old, and help them for a few years, if they're language delayed or not speaking or what have you, by the time they get to kindergarten, we have a much better shot that they're either mainstreamed or much more mild in their symptoms by the time they reach kindergarten. On the other hand, I've had numerous cases of teens and young adults that have improved as well, which tells me that the brain can change at any age. The brain is plastic. We call it neuroplasticity, and that's a really optimistic thing. Just yesterday, I was talking to a patient who's 29 years old. I've been treating this young man for a couple of years, and he's still very quirky and has many autistic traits, but it's been quite a dramatic change for the family in terms of his independence. Now he can have more coherent conversations back and forth. He can discuss what he wants and needs, and he's actually gained enough independence that he can walk to the grocery store, and he knows how to use money, and he can buy himself snacks, walk home, and he can also walk himself to a local gym and exercise and come home. And these are signs of independence that the family never had before for over 25 years of this young man's life. And so the family's really grateful for that, because it's given the parents a little bit of reduced stress, especially as long-term caretakers for a disabled young man. And I just had another patient. This is only 1 month that I've been working with this young man. He's 16 and severe OCD, violence, would put holes in the wall, and he was a triplet, and the 2 other siblings are neurotypical, and this one is like severely autistic. And in the first month of treatment, the OCD reduced rather significantly. The violence reduced rather significantly. He's no longer putting holes in the wall. He seems more engaged with the family. So, even for a very, very severe case as a teenager, we're able to see progress. But what we expect is that in those older kids, that the progress is more gradual. It's slow and steady. Whereas a younger child, their brain isn't quite as formed. So the possibility to rewire the neural connections in the brain happens faster. So so we do expect noticeable improvement quickly. Like in the first few weeks, we would expect a change. 2 to 4 weeks, we would expect a change with a good treatment that responds well. But we don't expect instant miracle cures. And the other thing that they found in this research study, this is real world, is that the child's state often changes over time requiring different prescriptions, homeopathic medicines. So, let's say a child starts with really, really violent behaviors and running away and banging their head and what have you. We may start with a homeopathic medicine that helps those concerns, and then now maybe the child's more calm, they're not as violent, they're not banging their head, but now a skin rash appears and the speech delay is the main problem. Well, we may shift gears and prescribe a new homeopathic medicine as those concerns change over time. And I've routinely seen that over the years, and I'll share with you some cases that are longer term cases later in this presentation, so you get a sense of that. All right. Now we're going to shift gears and we're going to go into a section about what is homeopathy, because I've gone over a little bit of an introduction about autism and an introduction to the research about autism with homeopathic treatment of kids on the autism spectrum. And now I want to share with you more about the therapy so you understand what the therapy is and what we can how you can understand the therapy so you can be, let's say, better participants in the therapy. So homeopathy is a method of using natural medicines. We call them remedies, but they're natural medicines to help treat illnesses according to the principle like cures like. And that's really an interesting thing. It sounds a little bizarre. I'll tell you, I was skeptical of it at first until I saw it work. But I'm going to describe to you how it works and what we know up to this point. And the other really good thing is it's really safe, gentle, effective natural medicine. And that's really a good thing, because there's so many things out there, and I hear so much from parents that they're worried, or let's say they had gone the conventional medicine route and their child was put on a really harsh antipsychotic medicine or something and had really bad side effects. And we don't want to do that. We want to use really, really safe, gentle, natural medicines. So let's talk about homeopathy as a little bit of what we call a hormetic therapy. Hormesis is specifically a study in science where low-dose stressors or toxins can actually trigger an adaptive response from the organism. So something that may be toxic in a really, really big dose, in a small dose, is just a mild stressor that then elicits a reaction from the body that is more healing, or in the opposite direction, actually. And so an example of hormesis is exercise. And I love this quote from Nietzsche, the philosopher: "That which does not kill us makes us stronger." And this is so true, right? Like, if you're exercising, if you overdo it, you could hurt yourself, but a little bit, just enough to get your muscles sore, is actually going to stress your body into having an adaptive healing response. So this is a good example here with weightlifting, right? Like, if you overdid weightlifting, you could hurt yourself. But if you gradually train and you increase the amount of stress your body's able to tolerate, what happens? The body responds to that stress by getting stronger. In fact, the muscles may be sore initially from that initial stress, from all the lactic acid buildup, etc., and the muscle tearing. But then the body repairs itself and grows even more muscle tissue and even stronger to adapt and overcome that stressor. And so mild stressors over time allow the body to have an adaptive healing or beneficial reaction. Now, the type of response you want from the body has to be individualized. You can't just do any exercise and get the same response. If you wanted big muscles, then lifting weight is the right way to go. But let's say you wanted to run a marathon. If you wanted to run a marathon, would lifting weights be the right type of stress for your body to elicit the reaction from your body to prepare for the marathon? No, it wouldn't, right? Like, in order to prepare for the marathon, you're going to actually have to get out and jog. And, maybe at first you're not going to be that good at it. You go around the block, or you go a half mile, maybe a mile. Then you work up to a 5K and then a half marathon. And at each point, as you gradually continue to stress the body adapts. The vessels to the heart get more efficient and grow more vessels. And over time, your body gets better and better at oxygenating so that you can go for a longer distance of time while running. So we have to individualize the type of stress for the adaptive response from the body that we want. And another example of this is allergy shots. So are allergy shots actually homeopathic? Well, I would argue that they are a form of homeopathy, actually. If you think about it, when somebody gets an allergy shot, they're actually allergic to the medicine. And if you gave them a really big dose of their allergen, they would have a reaction that would be bad. They might even get anaphylaxis. Their lips and eyes might swell up, and they might stop breathing and die. But if they give just a tiny amount, right, just enough of an amount, it triggers an adaptive response from the body where the body develops tolerance to that allergen rather than an overreactive reaction to the allergen. And along those lines, remember, homeopathy is like cures like. So here it's the allergen that they're giving as the medicine in a small dose that is triggering an adaptive response in the organism that's healing. And so what does that sound like? It sounds just like what we were talking about with hormesis, with exercise, or like lifting weights or jogging, right? And there are other hormetic therapies like cold plunges or breathing exercises, etc., that can stress the body a little. And then under that stress, as long as the stress is a small stressor that the body can handle, the body adapts to that stress and gets even healthier and stronger. So that's actually how homeopathy works. And so now I'm going to go into a little more detail about that, but there are basically three underlying concepts in homeopathy. The first is holism, the second is individualization, and the third is this Latin phrase vis medicatrix naturae. So I'm going to describe all of these. So holism, first, disease is often rooted in the problem of the person as a whole, and there's more to the whole than the sum of the parts. And if you think about it, like oftentimes I see kiddos on the spectrum and they may have behavior concerns, speech delay, they have digestive concerns, let's say constipation and violent outbursts, and they also have really strong sensory symptoms, let's say sensitivity to lights, noises, and smells. Okay, well that child, because of that holistic pattern of all those symptoms, the behavior symptoms, the speech, the constipation, and the sensory symptom, I would prescribe one homeopathic medicine for stimulating healing across all of those concerns. And what I would expect is that we see improvement across multiple concerns. We would expect the constipation to improve while the sensory symptoms improve, while the behaviors improve. Now, if you think about it in conventional medicine, they would treat it very differently. For the constipation, the patient may go to the gastroenterologist, and for the behavior symptoms, they might get therapy or maybe even a medication. And for the sensory symptoms, they don't really have many treatments for it, but maybe they would do occupational therapy, okay? But you can see what we want to do is prescribe one medicine that stimulates healing holistically across multiple planes. And we have to individualize. And I've been talking to you about that a lot. There are different homeopathic medicines based on different presentations that kids may have. And disease expression varies from person to person. And this is so true in autism because, like I said, if you've met one child with autism, you've met literally one child with autism. Because even though they have some common features, like the social communication issues and the restricted, repetitive patterns of interest, one child that is, let's say, constipated and has these sensory symptoms and maybe violent anger outbursts is totally different than another child who's like kind of calm but totally in their own world, and they are having diarrhea and they have a really bad eczema skin rash. Those two children, even though they have the common features of autism to get the same diagnosis, they're totally unique and different. And so as a result, we would prescribe a totally different medicine to the two different children. And because their symptoms are different, right? And so it is these unique individual symptoms that help us, the homeopathic doctor, prescribe an individualized homeopathic medicine. Now, the third main principle here is the vis medicatrix naturae, which is a Latin phrase coined by Hippocrates, an old dead Greek dude, He was the father of Western medicine. That when doctors, when we become doctors, we take the Hippocratic Oath, and this phrase means that there's a self-healing tendency in all things. And think about it. Like if you cut your finger, you know, as long as you wash it and it doesn't get infected, and you maybe put a Band-Aid on it, and you let it be by itself, you don't even have to think about it. The body has this innate knowledge that, you know, a week will pass by and it will heal. You know, if you get a common cold, what happens? The immune system kicks in to fight the infection, and the body overcomes the infection and heals, right? And this is an innate capacity that we have in us to heal. Now, the problem is in complex conditions like, especially chronic conditions like autism, the body gets stuck. It's almost like the body starts to get sick and veer off course from health, and then gets stuck in this pattern of sickness and can't figure its way back towards health. And what we do with homeopathy is we trigger that adaptive healing response in the organism. We call that homeostasis, to return back to normal, right? Or return back to health, I should say. And this is like stimulating the immune system in an infection like influenza. Once we stimulate the immune system overcomes the condition and returns back to health. Now, there are three main principles in homeopathy. The first is like cures like. The second is minimum dose, and the third is the single medicine. So let's go through these. Like cures like is a term that Hahnemann coined, this phrase homeopathy, which literally means similar disease. Homeo, especially when spelled the old-fashioned way, with this diphthong OE, kind of like I live in Phoenix, Arizona, and we have the PHOENIX, and that is an old spelling in the Old English, but it derives from the Greek root of the word, and that means similar. So if you spelled it kind of the modern spelling doesn't have the OE in it, that would just mean suffering at home, but the correct spelling actually means similar disease. So pathos or pathy means disease. So examples like we talked about of like cures like are things like allergy shots or exercise, maybe even vaccines. You could put somewhat in that category. Now, materia medica, this is they have experiments. This word provings actually comes from a German word Prüfungs, and it got transliterated into English as provings. But basically, these were experiments done on healthy people, and they would give single natural substances to the healthy subjects, and they would have, you know, like you could think about like in the modern day, like a multi-center drug trial where you have different people supervising the experiments. And the reason during the experiments they give the medicine to healthy people is because in the experiments they want to see what are the pure effects of the substance. In conventional medicine, they often give a medicine to a sick person and they only want to look at one effect. And anything that's not the intended effect of the experimenters, they call side effects. And we all know those, right? Like on the commercials where they have that long list of symptoms that, you know, that they speed through really fast in the small print. This could cause diarrhea and blah, 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 and death, right? Well, those are all effects. We call them side effects because the company thinks they're side effects. But in reality, from the body's perspective, if you think about it, they're all equal effects. And the way we set up these experiments in homeopathy to discover the effects of substances that later we use as medicines, we do experiments where we don't predetermine what the effects are. We want to keep an open mind and experiment and record all the effects because none of them are side effects. They're just all equal effects. And so if, let's say, a medicine has an effect on the bowels and, let's say, dilates the pupils and has effects on the mood, those are all equal effects, right? And so we record all of those effects, and the reason we do that only on healthy subjects is because if you did the experiments on sick people, then you would have to distinguish what are the symptoms that are from the disease and what are the new effects of the substance that are super added on top of the disease. So there's one less variable. It's more scientific if you just say, let's take healthy people, see what the effects of the medicine are, and then you have less variables, right, to cause confusion. So during the experiments, they give one single substance to healthy subjects, and then they record these in encyclopedic books, and someone like me has them as software that's searchable on my computer because it's my profession. But I also keep these books on my desk, and these encyclopedic books are what we call materia medica, but it's basically the database of the results of those experiments. So if they did an experiment on a specific substance and they record all the effects of that substance, they're recorded in this database so that then the doctor who needs to access that information can find the information for the right medicine. And let's think this through, and I just want to give a couple of common examples of like cures like, so you get an idea of it. Now, we already gave the example of allergy shots, but this is a more simple example. Let's say you gave a healthy person coffee, and let's say it was a healthy person that was very sensitive to caffeine. They develop a lot of symptoms when they have caffeine because they don't normally drink it. Well, they might get really restless and agitated, and maybe they won't even be able to sleep. And some of you like your coffee. You feel really good when you're coffee. You're cheerful with your coffee. And so not only are you cheerful, but you're agitated and you can't sleep and your mind is racing, right? So let's think about a sick, we say sick patient, but a patient who's having similar symptoms. We could actually use a specially prepared and diluted form of homeopathic medicine made from coffee beans. So here's the example. You have a child on Christmas Eve who's so excited about Christmas and what presents they're going to get that they can't sleep. Their mind is racing and they're up and they're running around the house, and you just want them to go to sleep. And so in homeopathy, we may actually give them a tiny dose of a homeopathic medicine prepared from coffee. Now, not a big dose. If you gave a big dose of coffee, the kid's going to be so full of caffeine that they're going to be awake. But if you give a tiny dose, it's just enough of a trigger to the body to say, hey, that's not what I want. And then the body's reaction to that medicine that's a stimulus is to actually go in the other direction, which is back towards healing, which in this case is to calm the child down and help them go to sleep. Here's another example. Let's say we all know onions, and especially a healthy onion. If you were to give a healthy person onion, lots of onion, and you're experimenting with onion, you can imagine the symptoms you would get, like burning teary eyes and nasal discharge, burning nasal discharge maybe. And, the person may have to get fresh air just to get away from the onions so that their eyes stop irritating them. Well, you may think about a sick person who could have hay fever symptoms or maybe even a common cold symptoms where they're really similar to that, where they actually get really irritated discharge, almost like cutting an onion. Well, we may use a homeopathic dose of medicine made from the onion to stimulate healing from those allergies or the cold. Now, these are really simplistic examples, and onions and coffee actually are made into homeopathic medicines. And like I told you, homeopathic medicines are safe, gentle, natural medicines. But the medicines we often use in autism are more complicated because the condition is complex. So, something simple like this, like insomnia, you can maybe try something like that, like coffee, or cold symptoms, maybe the allium cepa medicine from the onion. But for a complex chronic condition, I really recommend that you see a healthcare provider that has expertise. Now, the minimum dose is another principle in homeopathy. We use, in medicine, there's this principle, first do no harm. So we use safe, non-toxic doses, and we actually dilute and succuss the medicine. So succussion is a form of agitation. So at every step of dilution, the medicine is not just diluted, but it's agitated. And that actually is an important part of the manufacturing process. It turns out if you just dilute the medicine dilutes and is not actually therapeutic. But as long as you dilute it and agitate it at every step, the medicine becomes actually even more potent or more has a stronger effect the higher the dilution and succussion in a patient who's susceptible. So you may think about this in a couple of ways. First of all, we are only sensitive to things that we are sensitive to, and we're not sensitive to things that we're not susceptible to. So think about pollen. Pollen are like these tiny little particles that float through the air. They're invisible to the naked eye without a microscope, for the most part, unless you can see big clumps of them, the yellow pollen. But generally speaking, if you're in your house, you don't see pollen flying around the air. But every year, usually around January or February, here in Arizona, there's a lot of citrus. It just happens that like one day, maybe my wife will wake up and she's all congested and can't breathe. And her nose is stuffy. And mine won't be. And it's curious why, right? Like she's susceptible to be allergic to those small, seemingly invisible pollen molecules, and in a very small dose that fly through the air and land on her nasal mucous membranes and trigger a response from her, but don't trigger a response from me. Why is that? Because she's susceptible. So the same is true for medicines. We use small doses of homeopathic medicines, and the good thing about that is they're very, very safe in those small doses. But they are only going to work in someone who's susceptible to that medicine. So someone who's not particularly predisposed to be sensitive to that medicine won't respond to it, which is good and bad, right? Like, it may be a little trial and error to find the right medicine, but the good news is it shouldn't cause adverse side effects. And this is, again, how we have to individualize the medicine to every patient. Now, the production of homeopathic medicines are standardized and made by several companies. Here's an example you may have found over the counter that's very common. A lot of people are familiar with these and they find them very helpful. For common self-limiting conditions, these medicines are available over the counter. For really more serious or chronic conditions, you need to work with a doctor. But the good news is homeopathic medicines have been regulated by the FDA since 1938, which was when the FDA was created. So there's manufacturing oversight and quality control, etc. Now, we only use one medicine at a time, and we can expect the best results using one medicine at a time. And the reason is then we can see, like I told you, it's holistic, and we expect responses from the patient across multiple planes, right? So if we're using multiple medicines at the same time, how do we know what's working and what's not, right? So by isolating the variables, doing one thing at a time, we can be really, really careful and methodical and clear and know what's working and what's not. This also, it helps us manage the case long term because we can assess the case more clearly and decide what to do next. Because maybe, let's say, the patient improved for a while, but then stopped improving. Now, what do we do next? Do we need to change the potency of the medicine to a different potency, or do we need to change to a totally different medicine? And if we're using multiple substances, it could get very confusing. But when we use one at a time, it allows us to be very methodical. Here's just an example of arnica. Arnica is common over-the-counter medicine. I think every parent should have it in their diaper bag. The number of times my own son has fallen and bumped and bruised himself, and a dose of arnica has done wonders. That's a common one that you can use over the counter, mostly for bumps and bruises. Now, single remedy medicines you can get over the counter. This is a picture from a local grocery store near me that's like a natural-minded grocery store that carries homeopathic medicines. And many of the common ones, they carry in lower potencies like 30C and some in 200C. These are some of the lower potencies. And so often, like if I have a patient who's sick and can't get to the office, or they don't live close by the office, I'll send them for the common medicines. We'll send them to one of these stores like Sprouts or Whole Foods or Natural Grocers that carries homeopathic medicines to pick them up. Now, our office carries a much wider range of homeopathic medicines, and also in much wider potencies, or so that that then are available over the counter. You also will see combination medicines over the counter. These are homeopathic medicines that the manufacturer basically puts the common medicines for certain self-limiting conditions in one medicine, and they work if the medicine you need is in that combo. If the medicine that's needed isn't in the combo, obviously it doesn't work, but the medicine is generally safe and not toxic or harmful. And the last thing I'll say about this area is that there's a real big difference between genuine homeopathy and non-genuine homeopathy. And there's a lot of marketing out there, and so it's kind of like buyer beware. There is this therapy called cease therapy for autism. It's somewhat become popular in internet circles, and I'll just give you the short of it is that I'm not particularly a fan of this. I don't think this is true homeopathy the way homeopathy was designed as a therapy. And in this case, I think that from my own experience, I've seen parents trying things a lot on their own and sometimes having more side effects. So this is not genuine homeopathy. I don't recommend it. If you want to have homeopathic treatment for your child, I recommend seeing a practitioner who does really genuine homeopathy like we do, the way it was meant to be done, the old-fashioned way. Okay, so now we are going to go into some case reports. I'm going to share 6 cases from my private practice and maybe end with a couple extra testimonials so you can hear what parents are saying about us. But what I wanted to do is offer you some stories of hope and also help you see what could be helped with homeopathic treatment. And you may see some elements, maybe perhaps of your own child's struggle in some of these cases. And that might be inspiring to you to seek out treatment to help your child. So, the disclaimer is I want to show you what's possible, and not all cases respond as quickly or as dramatically. And many autism cases require different prescriptions over time, over the long-term course of chronic disease treatment. And I mentioned that earlier in the research. They found that. And it is definitely something I found clinically as well in my own experience. And but I do want to share with you, lots of kids can get help, and I do want to offer that message of hope, and also just share with you my experience. What is it that I've seen getting to work with these kiddos? So let's start with this young boy, PH, who was 6 years old when he first came to see me, and he had autism, speech delay, and allergies were his main concerns. He first came to me in June 2nd of 2016, and he was referred to me by a neuropsychologist in town who has seen the work we've done with kids and has recognized that we've been able to help some of these kiddos with natural medicine, and so they referred this boy to me. And he had chronic allergies, autism, and speech delay. And in his history, he was born 7 weeks premature, and he had 2 older siblings that were neurotypical. And he also saw many specialists due to a lack of eating, poor weight gain, and speech delay. And he also had ear tubes at 3 years old due to the speech delay, but it didn't really help the speech much. As a young toddler, he even had a high fever with fluid behind his ears. And at that time, he was babbling some mama and dada, very simple babbling, but it stopped after the fever. And once he got the ear tubes, he started making noises and babbling again, but he didn't start talking. After that, he was in speech therapy for 2 years without any benefit. And this is something interesting I've seen, is that, there's a component of nature and nurture in every case. And I think of therapy like nurturing the child. And nature is more like, are we going to stimulate healing internally in the child to help their brain heal? And I've heard repeatedly experiences where kids start homeopathic treatment and they start making progress with speech, and the speech therapist comments, "What's different?" All of a sudden, they're making a different trajectory in their speech. So, the therapy is great. In some kids, it's almost like this child, where for 2 years he was making zero progress in speech therapy because almost like the brain was stuck and it needed to be unstuck to start learning speech, right? So that seemed to be the case here. He was also diagnosed with a tongue tie, and it was surgically corrected when he was 5 years old. That actually helped. He stopped gagging on foods, and he started using very limited speech. Now, when he came to me, still the main concern was expressive speech delay. His speech was very muffled, as if his mouth and tongue were clogged and full of nasal fluid, and also worse when his allergies were bad, which you can imagine, the chronic congestion from the allergies. And despite the fact that he couldn't really use expressive speech, he was very smart. He was reading at a first or second grade level. He was typing with 2 hands. He understood coins, times, his parents' phone numbers. He knew their address. He knew everyone's name in the family. He just couldn't really talk. He also had really, really severe allergies since he was born and was taking allergy medicine every day. He had very large adenoids and tonsils, and actually a doctor advised him to take them out, and surgery was scheduled, but then he had a sleep study that ruled out sleep apnea. And before doing the surgery, the parents decided they wanted to try natural medicine, so they came to me. And he also, with the allergies, he had constant runny nasal discharge that was like green, and these paroxysms of sneezing like 30 times in a row, and it was worse in the morning, and aggravated by strong odors like flowers or perfume. Now, those details may seem unimportant to a conventional doctor, but those things that modify, that make a symptom better or worse, are important for you to pay attention to in your child, because those are clues that are very helpful to us, the homeopathic doctor, to individualize the treatment. He also had really severe digestive problems and a very restricted diet. He only ate very few processed foods. Like many kids I see on the spectrum, it's something we work on with our nutrition part of our work with kids. But, they can be very OCD or finicky and picky in their eating habits. And with this kiddo, he craves salty foods like McDonald's French fries, Lay's potato chips, Cheetos, Goldfish, and movie theater popcorn. He would only eat one brand of white flour pancakes, and he would only drink water and wanted it cold. And he had horrible bowel movements that would range from loose diarrhea to constipated, but at least a couple times a week he would have these large loose stools that were full of mucus. So something was wrong in his digestion, some inflammation in the gut. And on the other hand, when he would eat cheese, he would have these like sheep pellet stools. And when he drank milk, he would break out in rashes. So, in general, he was very, very fatigued even after sleeping 10 to 11 hours a night. And kind of somewhat unique and individualizing in a case of autism, he was highly empathetic and loving. Not all kids can be that way. They can be loving, but in terms of the intensity of the empathetic nature was marked, I should say, in this case. He didn't sweat very excessively. So in June, this is June 2nd, 2016, we prescribed an individualized homeopathic medicine. For our purposes of this presentation, I don't think saying what that medicine is would be super helpful to you, because that's my job to figure out in these complicated cases what's the best medicine based on these complex symptom patterns. But the basic part of it is that I gave him a homeopathic medicine. It was very easy for him to take 2 pellets dissolved in his mouth once a day. Now, a month later, July 5th, his mom reported that his sneezing was almost completely gone, and the runny nasal discharge was completely gone. And she had stopped Claritin and Benadryl because he was doing so well even without it, which he had been taking for years. And he hasn't needed any allergy medicine. His large loose stools with mucus, he had none. So the bowels improved, the sneezing improved. Remember when I said when we treat using an individualized homeopathic medicine, we want to stimulate healing for the child as a whole across multiple concerns. and we pick a medicine individualized based on that, and we want to see healing across multiple areas. So here we're seeing improvement in his allergies, we're seeing improvement in his bowels, and he seemed to be improving. So we continued on that path. I think I accidentally deleted a slide here, so I'm just going to go off the cuff and tell you. He had made dramatic improvement in his speech, actually. So he went from like, I think 60 words to 1,000 words. And he started speaking really, really quite dramatically. And this young boy responded to several potencies of the medicine. And occasionally I needed to give a different medicine when he had like an acute cold or something like that, and then we would go back to his chronic treatment after the cold would resolve. And I had the opportunity to treat him for about 1.5 years. And here is a video testimonial from the mom. And what I'll share with you is she probably recorded this 6 months into treatment, so you'll get a sense of kind of what's possible. But I think what's remarkable here, he had improvement in all those different things: the digestion, the allergies, the speech, etc.
I had been to 30 plus doctors with our youngest son. He physically developed normally. He just had trouble speaking. He'd get so frustrated because he couldn't communicate. Dr. Oskin was referred to us. He's really changed our lives. He's changed Peyton's life. It's been 6 months, not even 6 months. He's a completely different child. It's just been an amazing change in our little boy that we've been waiting for. He's saying things now to us that we've never heard before. Good night, Mommy, I love you. I always say we owe it to Dr. Oskin, because truly, with the remedies that he's put in place and we followed, and his diet, it's just been truly a miracle.
I love stories like that. It's just so heartwarming, but I don't want you to have to trust me just because I'm telling you. I want you to hear from the parent's perspective that there is really hope out there for your child.
I had been...
So let's make a little aside. I want to talk to you a little bit between the first case and the second case about thinking about temper tantrums, because many kids have tantrums, and I want you to ask yourself the question so that you can prepare for your visit with the homeopathic doctor. Are the tantrums the main challenge for your child? They may be really challenging for you, the parent, but are they the main challenge for your child? And I want you to think about, why is this child acting out? Is the child inherently angry or violent? Some kids are. And so we need to use homeopathic medicines that are individualized based on the tantrums that have those elements of the violent anger outbursts. But some kids are not. And so I just want you to think about it. What are the actual triggers? What sets them off? And what's also consistently makes them worse? Are there certain circumstances that make their behavior worse? And what makes the tantrums better? I want you to also think, is there some unmet need that they can't effectively meet, that they can't effectively communicate? So a lot of the kiddos I see are language delayed. And think about a child who's a toddler that doesn't yet have speech, and they want something and they just can't have it, and they're throwing this massive tantrum, and finally you figure out they just wanted their water bottle, or they wanted a banana or something, right? But they didn't have the language to share that with you, right? So sometimes we may see behaviors because the child's hungry or tired, or maybe they have a soiled diaper, or they have to use the bathroom and they're not potty trained yet. Or maybe they have pain, maybe they're sick, or they have abdominal pain or a headache or some emotional upset, or maybe they're stuck in an OCD loop, or they're jealous, or etc. So they might act out in frustration or pain. And if we are able to figure out those consistent triggers, that might help us with the homeopathic medicine, because the individualized nature of that upset may help us to prescribe an individualized homeopathic medicine. So let's move on. Now, this is the case of a 14-year-old male with autism and speech delay. This is one of my current cases. Interesting. Just I'm recording this in 2022. This case came to me in October of 2021. And in terms of his history, this boy and his older brother has high functioning autism, and this patient is lower functioning, and they're 18 months apart. And throughout the pregnancy, he basically had low mobility and measured small, and he was induced early, but had a normal birth at 38 weeks. But when he was young, as an infant, he was active. He made good eye contact. He was meeting milestones a month earlier, and he was actually meeting milestones faster than his brother. And around 1 year old, he actually would greet his dad when his dad came home from work and would say "Dada" and put his arms up. He was verbal early. His speech was a little odd in that it had a sing-song quality, but he did have that social interaction. And then later he regressed. First, it started around 18 months, and mom was 4 months old with 4 months pregnant with their third child. And his vocabulary plateaued and he started pointing to things rather than asking. He had previously would be able to ask and stopped. And she was concerned that he wasn't following directions and was trying to escape. And his naps and his nighttime sleep worsened as well. So he started, he also had a new aggravation from milk. He started vomiting after drinking milk from his bottle. And then the regression kind of plateaued, but eventually continued, and then it got really bad at a certain point. And Dad had a military deployment Labor Day weekend, September 2009. And it was very shocking and confusing for the little boy. He didn't know where Dad went, and he would run around in circles saying, "Where did he go? Where did he go? Where did he go?" And he would just be crying. You can imagine the grief and the shock of this child not knowing where his dad went. And he cried every night and then stopped sleeping and began having night terrors. And mom was super stressed because you can imagine mom has, a child 18 months older than this. She has this little boy, and she has an infant, a newborn. So he started having other kind of behavior start. So he started walking on his toes. And around that time, he also fell sick with a cold and was vaccinated while he was cold, which, just as an aside, I recommend if you're getting vaccines to make sure that if your child's sick on the day of their vaccine, I know it's inconvenient, but reschedule and wait till they're healthy. It's just less for the immune system to have to deal with all at once. And afterwards, he seemed to lose his spark in his eye, and mom remembers this quite vividly and has pictures of it. And he used to be kind of calm, and it changed, and now he couldn't sit still and became very hyper. He would constantly put things in his mouth and was eating all these indigestible non-food items. And mom was really trying hard to keep him talking so his speech didn't go away. And so she worked so hard to sing the ABCs and say, "I love you." And there was just one day when he just stopped talking and he just couldn't do it. And so mom made an appointment for an autism evaluation. And in November 2009, the week before Thanksgiving, he was diagnosed with severe autism. Now remember, it was only early September that Dad deployed to the military on Labor Day weekend. So he had a really dramatic decline very rapidly at that time. Now what was unique is Dad came home in December 2009 for a month to find out what was going on with his son, and he started talking, and the boy said, "Daddy's home." It was like a shock. He hadn't been talking, and all of a sudden some speech came back. And that improvement lasted the whole month of December while Dad was home. But then Dad had to redeploy. And at the end of December, he was gone till March 2010. And when Dad left again, the child withdrew and regressed again. And he was markedly different by the time Dad came back in March. He would keep to himself. He only wanted to lie in front of the TV. He stopped engaging or playing with his brother. He was obsessed with certain toys and needed them to be a certain way, that kind of like fixation and OCD-like behavior. And this is 2010. It wasn't for another year or two before he could say his name again after the regression. And after Dad came back a second time in March 2010, he just got worse. So this is so interesting. And remember from that research study I told you about, they identified some children who had a really strong emotional trauma, like a grief, and that the child regressed after the emotional trauma. It was almost like a shock to the system, and it affected the developmental trajectory for the child. And that's very much like this case. And Dad actually documented it in a blog about watching his son slip away. Really sad. Some additional things, they managed to potty train him to urinate, but he still had very frequent bedwetting, which was especially worse after he ate things like sugar and milk, like ice cream especially. And it took about 10 years to get him to have a bowel movement in the bathroom or go to the bathroom any other place than home. This was pretty limiting for the family because he wouldn't have a bowel movement in a stall in a public restroom, and he would hold it if they went to places like Disneyland. So he would literally be holding it all day and be uncomfortable, and they'd have to make arrangements to stay in a hotel really close to the theme park so that they could take a bathroom break and go back to the hotel room, and then go back to the theme park during the day. And he would have a stool and a pull-up diaper for a very long time. And even at the age of 14, when he came to see me, he's never learned to sit down to have a bowel movement. And they tried extensively with ABA therapy to get him to have a bowel movement on the toilet, but he just wouldn't do it. And so he had this procedure that would take a long time where he would stand over the towel on the ground with one leg propped up on the lid of the toilet, and he would pass stool onto the floor. And Mom told him that he had to sit down to stool, and he would say no. And so it was stressful for the family because basically somebody always had to be available to clean him up. So Mom basically said this is very restrictive to their life because they couldn't travel much or have a day where they went and did activities without being close to the home toilet or what have you. And they didn't feel comfortable leaving him home with like a caretaker who would have to clean up the mess of the stool. So another interesting thing, he oftentimes kiddos on the spectrum have, they have really intense or unique food cravings. So in this case, he would drink, he loves salty stuff. So he would drink like an entire jar of pickle juice. And although that may seem unhelpful to a conventional doctor, these kind of unique individualities and intricacies are actually often helpful to us, the homeopathic doctor, in terms of prescribing a homeopathic medicine. So what happened? So we prescribed a homeopathic medicine. And when he came to see me in October 2021, he had a lot of speech problems with echolalia, and he had like almost like a central auditory processing disorder or phonological processing disorder where he couldn't hear sounds quite right, so he would speak them incorrectly. So he would mix up sounds like raccoon instead of baboon or what have you. Now, he saw another naturopathic doctor before coming to see me who treated him with B12 shots and leucovorin. Leucovorin is a prescription drug version of Phlenic acid, which is a B vitamin. And he actually made a little bit of improvement on this. His speech was a little clearer. And remember, I mentioned this early on in the presentation. I'm going to go into a little more detail about it here. But there's this study by Richard Fry, who's now at Phoenix Children's Hospital. This study from 2016, what they found is that in children who had this folic acid receptor antibody test, that identified an autoimmune inflammation in the brain at the folate receptor. So this B vitamin receptor, if you can imagine, there's a receptor on the cell, and then the vitamin has to attach to the receptor so it can go into the cell. It was blocked by the inflammation from the body attacking itself, or the immune system attacking itself. And so what they found in this study was that the kids actually made, in 12 weeks, a high dose of this Phlenic acid B vitamin resulted in improvement in verbal communication compared to placebo. So this is a test I do on all kiddos in my practice on the autism spectrum, especially if they're speech delayed. And we also do make some dietary changes that they've been found in the research related to this. So the first thing we do is identify if the child has this problem, and then we we treat them accordingly based on the research. So the dose is established in the research. Now, the point of this is that the other doctor that the child went to before seeing me basically just put him on the Phlenic acid without testing him. And he improved a little bit. But he actually wasn't even taking the full dose of the medicine. So what I did was I decided before even doing homeopathy with this child, I was just going to do the Phlenic acid therapy. And we tested him. And we said, let's see how he does on the Phlenic acid therapy. And we'll also test him. And it turns out his lab test came back positive for the Phlenic acid receptor antibody. And so we titrated him up to the full dose. And by his first follow-up in November, he actually was titrating up, but basically had kind of like plateaued. He stopped improving with the speech improvement. And so we gradually got him up to the full dose. And then once we got him to the full dose, we added the individualized homeopathic treatment. So now let's fast forward to December, mid-December, and Mom's saying he's making gradual improvements, but not as dramatic. Now, this is important because remember what I said. If a child is older, we don't expect like immediate change, but we expect slow, steady progress. So even for a 14-year-old, we can see progress, even in core autism features like speech delay. And she said he's now sometimes says some things that he's never said before, using some spontaneous speech. He asked a question like, go to church, with a question mark, with an inflection that he never did before. And he still had less moments when he was scripting spontaneously or erratically from one topic to the next, as if Mom said like his wires were crossed. But the ABA therapist actually gave an independent report to Mom saying that he was scoring his best ever in speech exercises. So we do see definitely some consistent improvement there in speech. And then because the medicine's holistic, we want to see improvement across multiple areas. The bedwetting significantly improved, and overall he was improving. So, but he had kind of plateaued on that dose of the medicine. So I went up in the potency in his homeopathic medicine. So we stayed on the same dose of the homeopathic medicine. We just bumped up the potency. So by January, speech was still gradually improving on the new dose of the homeopathic medicine. And in fact, he was nonstop talking to Dad at the park about where he wanted to go and what he wanted to do. He wasn't using complete sentences, but it was much more than normal, Mom commented. He would say, let's go to this place, and then let's roll down the hill. And the ABA language therapist commented to Mom that he was making remarkable progress. And that the prior week was his 15th birthday, and he was engaged. He sang the happy birthday song to himself. And even with having like the dietary indiscretions, like the ice cream and stuff, the birthday treats didn't cause a regression in bedwetting and stimming like they used to do. Mom thought this was pretty remarkable that even with those dietary indiscretions, he didn't have a relapse. But definitely much more engaged. Like the idea that being engaged in the birthday stuff was new, more with the family, more connected. His repetitive language was still there. The bedwetting was significantly improved. And the toileting was quicker and easier for him to have a bowel movement. And Mom said that's the difference between a major impairment and being less severe in his needs. In other words, for the family, it was a big improvement. It was a big help to them that it was quicker and easier for him to have bowel movement. So he was still responding, so we kept him on that potency of the homeopathic medicine. And then by February, he had a little bit of regression, so we, with a little more scripting and getting stuck on words or phrases and repeating them over and over, or what we call word hunting, which is he couldn't, you can't find the right word. You're like searching your mind for the right word. And he had wet the bed once. So we decided he was no longer responding to the homeopathic medicine. It was the same medicine. I always say if it ain't broke, don't fix it. So we kept him on the same medicine, but changed the potency. Okay. So we went up in potency, and 2 weeks later, I get a call from Mom. She said that the boy said, "Mama, I have something to tell you." He said in a sentence she couldn't fully make out, and then she said, "Really?" And he said, "Yeah." Mom told him she was going to take a bath. He said, "First you take a tub, then I take a tub." Okay? And she was like astounded. She said this was the first time he's ever had this like kind of back and forth conversation. So she's very pleased. He's making steady progress with both speech and kind of like social emotional communication. So we kept him on that medicine. And he continues under my care and is continuing to make kind of steady, gradual progress, which is what we expect for a 14-year-old, 15-year-old. We don't expect any overnight miracles, but definitely improvements that are improving his quality of life and the quality of life of his family. Now, I want to take a quick sidestep after this case to talk about some expectations for homeopathic treatment. Other doctors may mention using homeopathic medicines. Many are using combination remedies. They're not using individualized prescriptions of one medicine at a time, or they're not experienced as experts in treating autism. So what I would recommend is that really for a condition or complex issue like ASD, make sure you're seeing a practitioner that's both like a real expert in homeopathy and also has expertise and experience in spectrum disorders. And it's my bias, but I recommend seeing a genuine classical Hahnemannian, pure orthodox, old-fashioned homeopathy. I don't know what the right word is for it, but there are lots of these newfangled ideas out there that I don't think have stood the test of time and experience. So I always recommend using one remedy at a time. These are questions you could ask a practitioner. How do you practice homeopathy? Do you do it the old-fashioned way? Do you use one remedy at a time? We want to keep the variables as constant as possible so we know what is working and what's not working. Now let's talk a little bit about follow-ups, tracking progress and observations, and how you as the parent can be an active participant. So in this case that I just told you, there were a couple of times when, let's say, the child stopped improving in his speech progress, so I changed the potency. So let's say we started with a certain potency like a 30C and then changed to a 200C. That's like the next dose. The numbers are kind of funny. I don't have time to go into that explanation during this presentation, but for our purposes, the commercial doses available would start with, let's say, a 30 and then go to a 200. Well, as you can see by this graph, when you start treatment, you may see improvement for a while, and then the improvement may kind of like level off or plateau here. You can see it in the graph. And this would be when it's plateaued is probably a good place to catch it early to go up in potency if they're no longer making consistent progress. But if you miss that window, the symptoms might slightly regress and get a little worse. It's not a big deal. It is very much correctable. But what we would do at the next visit or doctor's appointment, etc., we would notice this trend of getting a little worse, and then we would change the potency and see improvement happen again, just like the case I just presented to you. Now, what I will say to you is any child can have a good or bad day, so we don't make these decisions to change the potency based on single data points, but what we're looking for are the trends. Is the trend that the child's improving, or is the trend that the child improved for a while and is now getting worse? If that's the case, then we definitely know that it's time to change the potency, or maybe even a different remedy if the picture has changed. But in this case, you see that the picture stayed the same. We just changed the potency, and it continued to help the child. And what do we expect with chronic homeopathic treatment? So here, this is a good example here. We see this graph here. Without homeopathic treatment, things in chronic diseases just tend to get worse, right? And sometimes with conventional medicine, especially if there's a good palliative medicine that just kind of suppresses the symptoms, it can kind of keep things level, but they don't really like improve the overall condition. They just kind of keep things at bay. And with homeopathic treatment, gradually over time, what we see is that we make 2 steps forward, and then maybe there's a slight regression, and then we make a change to the potency or the remedy, and then things improve a little more, and we go 2 steps forward and 1 step back, and 2 steps forward and 1 step back. And gradually over time, the overall trend or the overall trajectory is a positive trajectory. And that's what we want to see. If we're seeing progress like that overall, then we know we're on the right track. So the timeline, of course, it's a lengthy new patient process and interview. So for me, a new patient interview is 2 to 3 hours. We take exquisite detail. We don't rush. We want to be thorough, and we want to get it right. So we set aside, we block out that time in my schedule to make sure that we can take a very thorough history and understand the concerns very intimately. We expect the medicine to work gradually over time, and I usually have roughly about monthly, sometimes a little more, sometimes a little less, depending on the circumstances, for at least 1 or 2 years or more. And I've had some cases, especially like some severe autism cases, that I've treated 5, 8, 10 years, and they're still making gradual progress. So in a very complex issue, long-term treatment is often very helpful. Again, we see this 2 steps forward, 1 step backwards trajectory. And I will say the homeopathic medicines are very safe and gentle, but sometimes, because it's so individualized, every child's symptoms are unique. And because of that, there may be a little bit of trial and error. So, what I would say is that many cases we see improvement right off the bat with the first medicine. But don't lose hope if you don't see improvement on the first try, because it is a process of individualization for every unique case. So it may be that we need to try a couple different medicines if we're not seeing improvement within a reasonable amount of time. I would say, if you're not seeing improvement within a month, I would stop a remedy and change the remedy. That's my approach. If I'm not seeing any improvement within a month, I change, because I think that we should be seeing some improvement within a month's time. And another thing is that kiddos on the spectrum are often sensitive. They're sensitive to everything, right? Like, they're sensitive to sensory symptoms and digestive stuff, etc. So they can often be sensitive to medicines as well, and they respond well. And it's actually a good sign when they're sensitive to the medicine. It's a good sign that they're going to have a positive response. But sometimes in homeopathy, we call this a therapeutic aggravation. Therapeutic because it's a good thing. And this I want to warn you about, which is that the symptoms may get a little worse before they get better. And if that's the case, it's a good sign. But what you should do is if I'm your doctor, contact me or contact your homeopathic doctor. I usually stop the medicine for a period of time, let the storm pass, and then we modify the dosing after that because of their sensitive nature. And I've seen that, in many kids, probably about 15 to 20% of the kids are really sensitive like this, and we have to modify the dosing. But it's, again, a very good sign that we're triggering this adaptive healing response with that initial hormetic mild stressor, the homeopathic medicine, and then it's actually triggering an adaptive healing response from the child, and that healing is on the other side of that. And so what I would urge you is patience sometimes while we figure out the correct potency or dose or frequency of dosing in the beginning, especially in a sensitive child. Now, many kids on the spectrum are seeing other naturopathic doctors or are already on many meds, supplements, and other therapies. Here's my approach. I like to keep the variables as constant as possible. So if you come in taking a bunch of stuff, I usually keep that constant. And I very slowly wean the other supplements or medications only after I know that I can see that the child is steadily improving and at a new level of health. And then something also to be noted, especially with psychiatric meds, is that if you wean them too fast, they can cause worsening. So we often go very slow and low. We go really steady, slow changes, so that, and if there's, let's say we wean the medicine and then some of the symptoms get worse, then I can adjust the homeopathic medicine and change one variable at a time, so we know what's working or what's making things worse. And this is a good procedure. I know it's gradual, and I know parents are often in distress and they just love their kids so much, and I know you love your kids so much and you want everything to be better really quickly. But my experience is that when we're methodical, even if it's slow and steady over time, we're going to get much bigger gains over the long run than if we, in haste, because we're feeling distressed, if we change things too quickly, right? All right. Now let's get back to some cases. So this is a 5-year-old with autism, speech delay, and violent behaviors. And this little boy came to me in the end of January 2016. And prior to 1.5 years old, he was able to say about 43 words in 3 different languages: English, Spanish, and Urdu. The mother is Hispanic and the father is Pakistani. And he was able to follow simple commands like "bring me your shoes." And then around 1.5 years old, he regressed. And he started losing words with no known trigger. He stopped talking. They know there was no correlation to vaccines because they had delayed the vaccines, actually, because the older sibling was also on the autism spectrum. So with this child, they decided to be more cautious and delay the vaccines. Now, he started stimming with flapping his hands at his ears and crying a lot. And he stopped playing with the family and didn't like them hugging him as much. And like I said, his older sister had autism, so they caught his regression early, and they quickly got him therapies like OT, speech therapy, physical therapy, and ABA between the ages of 2.5 and 5. Now, they did an EEG and ruled out seizure disorders, which is often helpful because seizures are a much higher incidence in kids on the spectrum. So when they came to me in January 2016, he was nonverbal. He had no interest in potty training. He wouldn't play with his toys. He was obsessed with computers and phones. And he would go to YouTube and watch the same things over and over and over again. He did a lot of stimming, like flapping his hands over his ears, covering his ears, and humming. And he was also very aggressive and violent, especially jealousy. He was extremely jealous of his younger sister. And if the mother especially, but any parent gave the other sibling any attention, he would like violently act aggressive towards her and hurt her. And he had this worried, anxious look all the time on his face. This is actually a picture of the child that the parents authorized me to use, but you could see like the look on this child's face at that time was very anxious and distressed. Some additional things: he was very restless. He had lots of bedwetting. He was fearful. He was afraid of water and afraid of the shower, afraid of animals, which, to a conventional doctor may not be helpful, but those details are helpful to selecting an individualized homeopathic medicine. And he had really, really dry, chapped lips. So let's see. So we gave him a homeopathic medicine, started homeopathic treatment, and followed up in 1 month, so March 2nd, 2016. And in terms of social interaction and awareness, his eye contact was improving, and he was playing with people. So that's a really important distinguishing symptom that we're starting to be more connected in our world and interested in other human connection. And in the morning, instead of going straight to his computer, he would now go straight to Dad to cuddle or have affection or hug him and play with him. And he would kiss Dad when Dad came home from work for the first time. This is really important markers of improvement in autism, to see that social interaction come back. Rather than just being in their own world. With potty training, he had an accident and actually went and told Mom, which is the first time he had ever done that. Typically, he was totally careless and unaware and didn't notify Mom, but it was striking to Mom that now he actually noticed that he had an accident and was interested. He was more calm. He stopped screaming and getting irritated as much, and the violence improved pretty dramatically. And he could now stay in the same room as his younger sister without violently hurting her. He still had some restlessness and violence at school, though. Still very early in treatment. And the anxious, worried look on his face was better. Mom hadn't even noticed it. So we kept him on the same homeopathic medicine every day. Later, he seemed to, like I said, 2 steps forward, 1 step back. Towards the end of March, he slightly backslid, so we bumped up the potency, but kept him on the same medicine. And now by April, he was having new words. He said park, buy, monkey, love, pho for phone, and mew for music. So he was making more attempts at speech, and he was pointing to objects to let the parents know what he wants, which is a big change, and trying to communicate more. Medically, we call that emotional reciprocity. Like the child looks at the cookie dish and kind of points to it, and then looks at you and makes eye contact, and then back at the cookie dish. It's how you, without full language developed in the child, you can kind of start to figure out what the child wants because you're emotionally connected, and the child can kind of communicate through nonverbal cues. And prior to this, the boy was so in his own world he couldn't do that. But now we're starting to see him interact more with mom, parents. The covering his ears and humming, the sensory symptom was improved. Restlessness was better. Before he was always running around. Now his energy is more mild and stable. Mom says that's a big improvement. And he's no longer jealous of his sister. He was okay with the sister being right next to mom or dad. And she could even be right next to him, and he wouldn't bite or hit her like before. That worried look on his face is gone. The fears were better. He could now tolerate being around a dog without running away. And the showering, the fear of the water was better. He could tolerate the shower. And wetting was gone, and he had dry diapers for an entire month. So he was responding positively, so we continued the medicine. And, this gives you a sense. I didn't give you the names of the homeopathic medicines because, I don't think that would be helpful to you because for me, I individualized the medicine. But what you'll see is that we used, over the course of 5 years, I've used 12 different medicines in multiple different potencies. So in some medicines on many different potencies. So those medicines were helpful over a long period of time, but we needed different potencies. Sometimes these were medicines for the chronic symptoms, and sometimes these were medicines for an acute, like let's say he had an acute diarrhea or an acute cold. We would temporarily change the medicine to treat the acute illness and then get back on track with the chronic medicine. But it gives you a sense that a case that we've seen over 5 years, we may need to use many medicines over time when the progress stops or the symptoms change. And so having an expert manage that for you is really important. Now the boy is 11 years old. He's doing really well. He loves school. He runs the school bus. He's moved from basically severe disability to moderate disability special ed classroom. And remember that actually follows what we saw in the research, that we're gradually seeing improvement. The other kids may stay in the same category their whole schooling career. They're in severe and they stay in severe. But here we see an actual improvement where they bumped him from a severe to a moderate classroom. He had no longer been restless or violent for many years. His anxiety and OCD were no longer a problem. And he was doing really well with speech progress. So he could repeat phrases when prompted. He could use an iPad talking device, but he was attempting vocal speech more and more, and he could ask for foods and other things he wanted or needed, which is a huge relief to the family and to the parents because they can actually now, they know what the child wants and they can help get him his needs so he's not needing to be acting out or throwing as many tantrums, right? And now it's 2022, but just look over the course of 3 years from 2016, 17, 18, you can see that worried expression look on his face is gone. The eye contact, the smile, the look, these are signs of greater interconnection and better calmness and ease and just improvement as a whole. So mom shared this testimonial. She said, this was actually back in 2018. She said, I just want to share with you something really good that happened this week. For the first time in almost 6 years, he said a 3-word sentence. We had a holiday and a family came to our house for lunch. After everybody left, it was time for the kids to work with their habilitators. So the boy took a bottle of soda that was on the table and he went to get help from the girl that works with him. Now the habilitator knows that my kids are drink soda once every 3 to 4 months. So she was ready to send him away when he said, "Open pop, please." She was so happy that he said the phrase that she honored his request and gave him the drink. Not my way of celebrating, but after watching his face all excited because he realized that if he wants something, he has to use his words, then I was almost ready to drink some too, LOL. This is a quote from the mom. Thank you for your guidance. If it wasn't for the changes in the nutrition in every single supplement that you suggested, plus the remedies, we wouldn't be celebrating improvements that were only possible in our dreams. Thank you. So, this just warms my heart. This is why I love working with kids and families and helping, seeing what this child is capable of, and really helping the family is just warms my heart. So now let's move on to another case. This is the case of a 7-year-old female with autism, speech delay, eczema, and Obscene seizures. And this is actually the older brother of the last case. So this little girl came to me in May 20th of 2016. And often I see this. So many families have multiple kids with developmental concerns. And what happened in this case was the boy started improving. So the mother said, I have another child who is on the autism spectrum. Can you help her too? So here you see the main concerns we talked about: autism, speech delay, early puberty. She was 7, but already having breast development and pubic hair development, which is too early. Epilepsy with seizures and behavioral problems and eczema. She had been delayed from infancy, and when she was about 9 months old, she was not playing with toys. And mom was pregnant with the son, the last case that we just discussed, when she noticed that this little girl was not talking and was way behind. She only had about 5 words at 18 months old, and the pediatrician at the time kind of brushed it off and said everything's fine, and she thought that maybe she was just delayed because of the multi-language household. But by the time the brother was born, she was just staring at the walls, not playing, and she would only move toys from one place to another, but she wasn't playing functionally with the toys. You know what I'm saying? It's like if you take a toy car and spin the wheel and just look at the spinning wheel rather than using it like a car to say zoom, 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 like like the toy is intended to be played with. Now, in the prenatal history, mom had actually had a real hard time with infertility and had lost 5 babies before this child was born, and took her to a fertility specialist and took some medication. She also had this genetic condition, MTHFR, methyltetrahydrofolate reductase, which is a mutation in the folate receptor where basically the folate enzyme, so basically folic acid does not get converted into folate. And we know from like spina bifida and everything else how important folate is in neural development in the baby. And also, from the folic acid receptor antibody, different folate issue, but here 2 different issues with folate that can affect development. Now, in the early history, this little girl cried all the time. They couldn't go to new places with more than 3 to 4 people around because it was too much for her. She didn't like being in stores and she would get overwhelmed. They went to daycare just before she was turning 2 years old because they thought maybe that would help increase her socialization. But it didn't work out. She was isolated the whole time, not talking, not playing, not interacting with other kids. And on the playground, she would just run around and scream and did not have any interactive play. By preschool, things kind of continued along this trajectory, and she had some of the similar behaviors, but she started hitting people. And she still hits people even at the age of 7. And when she wants attention, she'll punch, hit, push. Now, for her age, she's fairly tall, and she would hurt the other kids when she would want. It was unintentional, but she would hurt them when she wanted to play. But with providers, she would hit the providers, hit the other kids, therapist, teacher, and then laugh. She didn't really understand the consequences. So with the autism, she started OT and speech therapy at 3. She was officially diagnosed on the spectrum at 5 and started HAB and intensive therapies. She was in a self-contained classroom at school and received speech and OT. She was speech delayed. She could now talk, but very limited speech, and could only respond to simple questions, mispronounce words, and it's hard to understand her. She also had other behavioral problems. She was hyperactive, loud, couldn't sit still. She cried or laughed for no reason. She would run away. They actually had to guard the doors at school because she would run in and out of the classroom so often. And she had lots of these tantrums with screaming, crying, kicking the walls, and throwing herself on the floor. And hitting others, which we've talked a little bit about before. Hers was a little brother. She wasn't jealous for the attention like her brother, but more like a random striking out. And then, of course, she had the epilepsy that was diagnosed by an EEG. And another problem, I've seen this in numerous cases where these kids have a ravenous appetite. And she basically developed this as a side effect of an epilepsy medication. And they literally had to put up locks in the kitchen to keep her away because she was becoming so overweight. And they tried to see a dietitian to help with this, but it was almost like the never-ending pit. She just didn't get full. And we talked about her going through early puberty, and she also had chronic eczema and eczema her whole life, and cold sores. She was a really sweaty kid, especially at night. Her head was always sweaty. And a really gassy, loud, offensive gas. And she also had chronic daily yellow vaginal discharge. So a lot of symptoms, both physical and cognitive. And like we said, we always individualize the case. So we gave a homeopathic medicine kind of holistically for all these different concerns to stimulate healing for her as a whole person. And mom reported by 4 weeks in June 16, 2016, that she noticed changes right away. First of all, the eczema was gone. She said the first dose of the homeopathic medicine was on a weekend. She had a skin rash covering the whole area of her leg, her left thigh, and overnight it cleared up. In the morning, mom checked and it was gone. She had eczema most of her life. Now, I'll just tell you, that's a very dramatic response for eczema. Sometimes the eczema goes away more slowly than that. With speech, she had 37 new words in the past month. That's a big deal, mom said. Before, she gained about 1 to 2 new words a week. And now, boom, she's talking a lot, mom said, with complete sentences. Before, she would say, "Mommy, go to sleep," instead of, "Mommy, I want to go to sleep now." Even the HAB provider noticed the change. She was also speaking new words, both in Spanish and English, with good pronunciation, which was also completely new. The Obscene seizures were gone. Now, she normally only had 1 a month, even on seizure medicines, but basically they were gone. And a little spoiler alert, she's never had another seizure since. Ravis and appetite was better. She was now like, before she would eat like her food, mom's food, her brother's food. She would steal food. Now she was asking for the food but not eating it, and then would give it to her brother. The gassiness was better, so her digestion was improving. The daily vaginal discharge was better, which mom noted was a big change. She used to have like these laughing spasms for no reason. That was gone. So, basically she was responding. And I always say, if it ain't broke, don't fix it. So we continued the same homeopathic medicine and the same dose and potency because she was responding very nicely. And kind of like the last case, I'm going to summarize a long case very briefly, which is that over 5 years, we've used several different medicines. And there are times where she's responded to one medicine for very long periods of time, and then maybe the symptoms changed and she started having a certain particular anxiety for a while and OCD. And so we changed and helped those symptoms. And then and periodically we've had to shift treatment, but overall continuing to get better over the course of 5 years. And so now in 2022, she's 13. She's doing amazing at school. She's working really hard. She can actually translate for the teachers, and she speaks English, Spanish, and Urdu. She can read and sing in Spanish. She no longer sweats excessively. The anticipatory anxiety, perseverating OCD, perfectionism are no longer excessive or problematic. She's much more socially engaged. The restlessness is gone. The obscene seizures have been gone since that first month of treatment 5 years ago. Of course, her speech has improved. The eczema and cold sores are gone. The gas is gone. This girl is still prone to be overweight despite mom doing an excellent job with a healthy diet, but she's no longer ravenously hungry like when we started treating her. She can still be stubborn. So let's see what the mom has to say about her daughter's treatment.
She was a year and a half when we noticed, really bad symptoms. She was not really happy when we were close to her. She was not okay with us holding her, playing with her. Her speech was really delayed. She was not talking enough. She was not playing with toys. She was crying when we were outside. She was not engaging with other kids. She was not even paying attention to people around her. We were fighting a lot between my husband and I because we wanted to do so many things for her. He was really helpful with everything, not only with the remedies that he was recommending, the diet, and just in general, just listening to whatever I was, telling him, whatever I was worried about. Then he was like, okay, yeah, I understand. I know what you're saying. I know what you want to, find. I know what you want to, do for your daughter. So it was really good. Everywhere, she's really well known. And not because she was a girl crying and screaming and running away from classrooms and, fighting with kids. Now, the way everybody's greeting her, the way everybody's saying hi to her, shaking hands, holding hands and walking is really, really good. Everybody knows her now, but for a totally different reason. Recently, she was the student of the month. So it was really good to finally see something positive. After all the hard work, after all the therapies, after everything that we've tried, It's really good.
That just like warms my heart. That's why I'm so passionate about helping these kids. Homeopathy is such a special treatment, and it's so, people just don't know. And I don't want it to be this like best kept secret. I want more kids to get help. We're having this epidemic, and families out there like you need help. And that's why I'm trying to get this message out there and share these stories of hope so that you can see that there are possibilities for your children. So I have 2 more cases to share. I know the presentation's going a little long, but I think you'll find these last 2 interesting. These are identical twins who had a vaccine injury. And like I said, I've had many cases on the autism spectrum where there's no relationship to vaccines and their autism. But there are, unfortunately, some cases that I've seen where there's a very clear relationship between a vaccine injury and the regression of their development. So in these cases, let's start with this first one. This is a 6-year-old boy with autism who first came to me in August of 2017. He was born by emergency C-section at 34 weeks, but was normal. Everything was normal at the time, normal weight, height, no signs of being a preemie. Early on, they observed no problems with eye contact or connection, and he was actually a little ahead of his markers on his developmental milestones. He was putting shapes into holes before they were 9 months old. And of the 2 identical twins, he was the first to try walking. And he started saying some new words around 1. Now, there was a family history. The men in Dad's family had a history of speech delay. So there's clearly like a heritable or genetic disposition towards that. And they have another nephew who is not understandable until age 6 or 7. And sadly, this child had a regression after the DTaP vaccine around 2.5 years old. And what's interesting is this child had a welt at the injection site, and it appeared instantly after the shot and never fully went away. It was like this red nickel-sized welt, like a fresh mosquito bite, surrounded by a cluster of hives. And now, all these years later, there's this brown spot the size of a nickel that still hasn't gone away. And that spot still gets inflamed after a bath. But what was marked was after the vaccine, his language declined. And he stopped talking, and he started this high-pitched screaming shrill all the time. And in fact, the screaming was so bad that Mom actually wore earplugs for over a year because she couldn't tolerate the constant shrieking. His skin always felt hot to the touch. And he was diagnosed on the autism spectrum around his 4th birthday and qualified for therapies for occupational therapy and ABA. This is just a heartbreaking story, and but clearly this is what we call encephalopathy, or inflammation of the brain. In this case, he had a bad reaction to this stressor. In this case, the stressor was the vaccination, and it caused brain inflammation and regression. He also had a problem with constipation and onchopresis, which onchopresis is where this child's constipated and withholds the stool, and then stool leaks out, and there are accidents. But it started after a stressful time when the twin brother was basically separated. They were put in different classrooms at school, and basically he started withholding his stool, and it got so bad that he was hospitalized for it. And they're not sure what happened, but they think that he maybe when they were trying to potty train him at school, he was frightened and then started refusing using the toilet. And this was a significant problem because toilet training was basically holding this boy back and keeping him in a self-contained classroom with severely delayed children, even though he could read. He had limited speech, but they knew he could read. He also had picas, so chewing and eating non-food items. He had very little thirst, which, again, is an interesting symptom in that a conventional doctor wouldn't do much with that, but for us, that the lack of thirst is helpful for picking a homeopathic medicine and individualizing the case. He had a really frequent runny nasal discharge and dark circles, like allergy circles under his eyes, and was very, very picky and limited with his diet. So we started him on a homeopathic medicine individualized to his case. And at the 2-week check-in, the parents said, he's doing really well. He's been very carefully asking for things. He used to just yell out cookie or juice. Now he will say, "Can I have juice, please?" He will think about it and carefully ask. He'd think about it carefully, and then he's saying these like much longer phrases. That's a pretty marked change in speech in a 2-week period. And by 1 month, this is August 31st of 2017, he was talking in full sentences a lot. He had goals at schools that had changed from asking 2-word requests to full sentence requests. And he was saying hi to everyone when he would get to school, and he knew he had friends. So much more social interaction. He was leading the class every morning to read the day of the week and announce the activity, and he was singing and dancing, and the parents could actually understand what he was saying. And the teacher said that he's an all-star. The high-pitched screaming within 1 month was much less. It was now rare, and he would ask for what he needs during situations that he used to scream. How can you imagine as a parent? I'm sure a lot of you out there can do this. Your kid's screaming, having a tantrum. You don't know how to help them. But now the child's communicating more. He's screaming less. He can tell the parent what he wants. What like an improvement in that family's quality of life for the parent to be able to know how to help their child. He stopped hitting his head. His stools were better, and he was going to the bathroom regularly. In his pull-up, and no longer constipated. His runny nose was gone. He still felt kind of warm to the touch. So anyhow, he was still responding to the medicine, so we continued it. And eventually, like we've seen in other cases, 2 steps forward, 1 step back, at some point he stopped responding to the initial potency of the medicine, so we went up in potency at the end of September, and then later at the end of November. By January 2018, he was doing much better overall. He was making progress learning, reading, and math. He could add by ones. In terms of speech, communication, and socialization, he was now using full sentences. He had memorized songs, his parents' phone numbers, his address. He was using who, what, and where questions, like huge change in speech. He was independently playing games with his friends during social time and playing with his brothers, and much more emotional reciprocity, showing his parents things to his parents, being interested in showing them and connecting with them. By the end of January, he was greeting his providers appropriately and answering the door. He was still very social at school, and he had friends that he knew, and he knew everyone's name. In therapy, they actually were able to start working on proper sentence structure with prepositions rather than just saying a couple of word phrases, and they were also working on conversational skills. So huge thing. And then he was successfully potty trained. Woohoo! Can you imagine at 6 years old if you were the parent of identical twins who were 6 years old that were not potty trained? It's a lot of stress. It's a lot of diapers. And to have a child go from not being potty trained to potty trained, a major relief to the family. And by March, he was going to the bathroom independently without prompting or assistance. So huge marker of independence for this child. So this child continued to improve. They're very pleased with his progress after 8 months' time. So I'm going to just move along. I know the presentation is getting a little long, but I thought you'd really want to hear these stories, and I want to share them with you just so you understand what's possible with homeopathic treatment. So I'm going to talk about the twin brother. So this twin brother, identical twin, started treatment with me about the same time. And he also had very early signs of intelligence and reading at the age of 2. And he actually developed words before his brother. And before his regression, he could say dada, cat, ball, and some other words. But he also, unfortunately, had a vaccine adverse reaction to the exact same vaccine as his brother. But what's interesting is he didn't get a welt after the vaccine like his brother. Instead, it was as if the leg that was injected with the shot was paralyzed, and he couldn't move it for 2 or 3 days, and he couldn't walk, and he would just sit crying with the leg extended. And the leg was like limp, like it was paralyzed. Now, the reason I tell you this is that in homeopathy, we individualize the treatment. So even though these are genetically identical twins, and they actually both regressed after the same stressor, right? The same vaccine caused the regression. They had different, unique, and individualizing symptoms. And so based on these unique and individualizing symptoms, I actually gave each boy different homeopathic medicines based on their unique and individualizing symptoms. So that's why, we can't just have this shot in the dark, like oh, there's some treatment for vaccine injuries. No, I really encourage you to see a homeopath that is more of an expert in this, because they're going to be able to individualize the treatment much more to your child's specific symptoms. And so after that, the child regressed, and he started to only have single words and echolalia, and they had trouble understanding what he was saying. His pronunciation was poor, and his inflection was off. He started grunting a lot and making non-language vocalizations, and he was flapping and spinning a lot. So the regression continued. After that, he cried a lot. And, they noticed in prior photo albums he was a happy kid, he was smiling, and after that, he was like crying in all the pictures. And before the vaccines, they had pictures of the twins playing together. They could interact, and after that, they were like in their own world. They didn't interact with each other. And he just had a hard time paying attention and didn't want to participate in school. Really, really severe OCD, like the bedroom routine, the closet door position. There are all these things that were super finicky that had to be just right, or he would be set off. And the parents said that his regression was even more dramatic than his brother, because prior to the regression, he was on time or ahead of time with his developmental milestones. And after regressing, he lost speech, he stopped being active, he stopped climbing, he lost socialization, lost emotional reciprocity, and he started being really, really picky and restricted in his eating. And now this is from the Organon of Medicine, which is like the procedure manual for how we do homeopathy. There's this quote that says, the homeopathic physician must piece together the perceptible symptoms and peculiarities of the disease to be treated, because no true cure of any kind of disease can take place without the strict individualization of every case. And my point here being that, again, we have identical twins that both regressed after the same stressor, and that caused like this brain inflammation. And despite that, I gave different homeopathic medicines. Now, what happened? At 1 month, by August 31st, 2017, he was talking a lot more and learning many new words. He could say good night, hi, bye. He was echoing any word they gave him, which he wasn't doing before. He was using 2-word phrases like stop it, excuse me, which is new. Combining words, that's a huge leap in language acquisition. The clarity of his speech was improved, and the parents could actually understand what he was asking for. He would come up and clearly say pizza or juice. And mom said a stranger could understand him, not just the parents, because it was that clear. And he improved at school from making 2 independent verbal requests per day to 27. Huge leap in just 1 month time. He could now sit for 30 minutes at a time to attend to his schoolwork. And he was eating with his own fork for the first time. So talk about, again, focus at school, speech, independence, eating, right? And he's been playing games like Candyland with the other kids and sitting for social times. Before, he didn't interact like that, or would just run away and escape. So now we're understanding rules of a game. We're understanding socialization with other kids, right? Like huge cognitive leap in a short 1 month period of treatment. The OCD obsessions were much better. He wasn't getting out of bed every night. Constipation was better. He was flapping his hands less. Crying was significantly reduced. And he responded to this medicine very well. And in his case, we changed the potency of the medicine a couple times at the end of August and later at the end of September. And again, like, right, the 2 steps forward, 1 step back. When the progress in the case is not, if the child's not making progress, then we need to make a change. So in that case, we changed the potency of the medicine. And by 4 months, by January, he was more socially interactive. He would give hugs, say good morning, right? Social interaction, not in his own world, connecting with other humans. This is huge. And at school, he would sit to play Uno. He knew the appropriate rules of the game. He would play independently. He was talking more, repeating words. Potty training significantly improved. He asked to go to the bathroom for the first time. 50% of the time, he was dry at potty time. And previously, it was only 10% of the time. So he did really, really well. And again, the parents were really very pleased with the progress in just 8 months of treatment. So I stopped there because we could go on, but I think you get the gist of kind of what to expect in the timeline of good treatment. And I just want to summarize a few things. So with homeopathy in kids on the spectrum, we can definitely help language delays. You've seen 6 cases that I presented here with improvement in language delays. Sensory symptoms definitely were one of the best treatments out there for sensory processing problems. Tantrums and violent behaviors, for sure, we can help. And then again, you saw with these cases, homeopathy is holistic. So we don't just see the cognitive symptoms improve, but when the child improves as a whole person, we start seeing the allergies or the digestive symptoms or the skin symptoms or the seizures or all these other things start to improve as well, because the child is getting healthier as a whole. And like I said before, homeopathic remedies are easy to take and they taste good. So most kids like them, even really finicky eaters, which is really, really good for a finicky kiddo on the spectrum that's going to have a hard time taking lots of medications or supplements or etc. So we're coming towards the end of the presentation. I'm going to leave you with a couple more testimonials just so that you can see what's possible for your kiddos, and maybe it'll speak to you, but just so you hear from other parents. I don't want you to just trust it from my mouth. I want you to hear it from the mouths of the parents. And this is a patient I treated many years ago, actually, and the mom wrote me a letter. She said, "Dear Dr. Oskin, I want to let you know how grateful I am to you. I have been searching for help for my 12-year-old daughter for 12 years. And by the way, this child's father was a pediatrician, so it's really interesting. I have been to so many doctors over the years. From the moment she was born, I knew there was something very different. You were the only doctor that asked everything from the sweat beads on her nose to the smell of her feet, and you wanted to know every detail. You truly care about her, and it shows. We have been coming to see you since November of 2011. I guess I'm aging myself there. And have only been to see you about once a month, and the child is off all her medications. She was previously on several psychiatric medications and only takes your natural remedies. And she's getting A's in some subjects at school, and she's never read or understood a book before in her life, and now she's reading a book a week. And she is comprehending everything that she's reading. This is a miracle. I never thought I would see this day. She has lost over 20 pounds over the last 3 months. This girl actually gained like 60 pounds on a psychiatric medication that has a bad side effect of these kids gaining weight. But after starting the treatment, she started improving. And she is feeling so good about it. She can have a conversation that makes sense. Before she could maybe say things, but it made no sense what she was talking about. And now, imagine the ability of the parent to connect with their child because they know what she's saying. She has never had friends her own age before, and over the last 2 weeks, she has had 2 friends come over to our house, and this is also a first. She's just getting it, and all she is on are the remedies from you. I had just given up on and felt helpless about because no one has been able to help us till you. How do I ever thank you or repay you for giving my child her life back? I am so grateful. Thank you from the bottom of my heart. You are our miracle man." It's just like, these stories are the stories that just light me up, and this gives me purpose in life to know I can help you, help these families, and help these kiddos to live a better quality life, right? And this is from another long-term patient of mine. This mom said, "I remember 6 years ago a friend introducing me to an autism wellness summit. She said, 'You should listen in.' The only doctor I heard was the voice of Dr. Oskin. I immediately felt a feeling in my gut that said, 'You need to call his office and get an appointment.' Being that he was in Arizona and we were in Maryland, I wasn't sure if he would even consider a chat, but he did. 6+ years later, we are still going strong with homeopathic remedies, supplement support, nutritional support, and emergency needs and changes that with a simple call or email, Dr. Oskin has a solution. At age 8, I didn't think we would make our trip to Disney World fun or enjoyable, but because Dr. Oskin listened, took time to understand my son, my pregnancy, every detail, we had the most amazing experience. Tantrums were minimal. Bowel and bladder issues were not overwhelming, and eating food was a breeze." And let me just tell you, I've heard this so many times from parents that Disney World can be a nightmare for families, for kids on the spectrum with all the sensory symptoms and the crowds and the smells, and right? And for a family to be able to enjoy Disney is like a dream come true. The AZ Health Center has completely transformed our lives, and my now 14-year-old son who is thriving, happy, eats any food I place in front of him, amazes me and my husband on a daily basis. The education, listening ear, understanding, non-judgmental atmosphere that the center provides has immensely given us peace, reassurance, and most of all, positive outcomes with our son. We are eternally grateful for Dr. Oskin and the AZ Natural Health Center. So with that, I just want to end and just let you know that I'm just sharing my experience with you over the years. I've been doing this now for a while, and helping these kiddos is one of the greatest joys of my life, to really improve their quality of life, improve their health, improve the quality of life for the parents and the families. And this really, really is a special thing. I would be more than honored to help you along your journey. If this speaks to you, if you think that maybe homeopathy is that missing key that you're looking for to help your child, please don't hesitate. Check out our website or the Facebook homeopathy group, or call our office and see about the next steps that we can take towards working together. I hope that this has inspired you, given you hope for potentially what's possible for your child. And if it's right for you, I really look forward to meeting you and working with you. Wishing you all the best. Take care.